the Disability Inquiry Project, I selected to do research on a specific syndrome, 49XXXXY syndrome. So before we get started, a little bit about myself. My name is Madison Moore. I'm a junior at Central Michigan University studying Recreation and Event Management with a double minor in Disability Studies and Community Inclusion and Leadership. I selected this topic because it is near and dear to my heart, and this is a rare disability that others should be aware of. I've found that far too often, many people categorize disability into one big subject, when in reality, each syndrome is unique and deserves its own attention and understanding. In this presentation, we will be discussing several different elements of the history of this syndrome, how it came about, the stereotypes that come along with it, and how it has impacted people with disabilities and society overall. I find it extremely important to recognize each syndrome as its own, and we'll be talking about that throughout this entire PowerPoint. So here's a quick project overview. We'll start with an introduction as well as importance and overview of the syndrome. What exactly is it? Some background information and history, stereotypes and the impact, current issues, solutions, and then we will wrap things up with a conclusion. So, to get things started, the purpose of this research is to raise awareness about 49XXXXY syndrome through its history and development. Disability looks different for everyone, so whether that be amongst different disabilities or within the same category of disability, it looks different for each individual, and that should be recognized because it differs throughout, and we cannot generalize all disabilities because what one symptom one person may have, another person may not. Currently, the problem is that there's a lack of care for specific impairments, but a solution to that is emphasizing and understanding each disability for what it is and not comparing or generalizing information. This PowerPoint can serve service providers, teachers, students, and anyone else that is willing to listen because we can all benefit from hearing this information to understand and learn how we can better advocate and support people with disabilities within society. Importance and overview. Misunderstandings lead to a lack of care, which leads to poor treatment of disabled people. Many diagnoses and syndromes get compared or put under an overriding umbrella of disability that tends to misinterpret the specific syndrome at hand. In this case, throughout this presentation, I will be relating that to 49XXXXY syndrome. All of the following information will correspond to this course objective, explaining the process by which social and/or cultural forces shape some major aspect of social organization. As you can see, and you'll learn later more throughout this presentation, when we compare one another and put each other under one single category, we are neglecting the fact that we are all unique and different and need different levels of care. So, if we recognize this and start treating people with disabilities as they are and for what they need and the assistance they deserve, then we are including them within society and creating a better dynamic overall. So, as you listen and watch this presentation, you may be wondering, what is 49XXXXY syndrome? According to Genetic and Rare Disease Information Center, 49XXXXY syndrome is a chromosomal disorder in boys and men that causes intellectual disability, developmental delays, physical differences, and an inability to father biological children. So, in more simpler terms, this means 3 extra X chromosomes in comparison to the general 46 that all humans should have. Oftentimes, this syndrome is referred to 49ers, so throughout the rest of this presentation, I will be calling it that. This occurs in 1 out of every 100,000 males that are born, so it's extremely rare. And there are less than 5,000 cases of this within the United States. Some other symptoms of the syndrome include a cleft palate, cleft foot, language impairment, ADHD, behavioral concerns, and much more. One person can have multiple impairments and diagnoses, and each diagnosis could have similar attributes, but ultimately it stands alone and looks different in each male case. As I've already mentioned, and as I will be discussing in more detail throughout this presentation, one person could easily have 49ers, but also align closely with autism. But it's important to recognize that these two syndromes are not the same, and each should be catered with its own individual understanding. Background information. 49ers is not inherited. It is a random event that occurs during the formation of reproduction cells in an affected mother. During cell division, an error called non-disjunction prevents X chromosomes from being distributed among egg cells as they form. 49ers is often referred to as a variant of Klinefelter syndrome, but it differs in many ways and is much more severe. Many symptoms can be related to other diseases and disorders, and doctors may not have experience, which alludes to misdiagnosis. Disability is often misunderstood through stereotypes that negatively impact all of society to move away from disability rather than towards it, and that's something I will be talking more about in future slides. Now, on to the history of 49ers. As I mentioned earlier, this is one of the rarest sex chromosome disorders, with less than 5,000 cases in the United States. It first originated in Iran, and the first case was reported in 1960 by Fricaro et al., and it was first recognized as an aneuploidy syndrome. Aneuploidy can be defined as the condition of having an abnormal amount of chromosomes in a haploid set. As you can see from the picture on the right, this was the first male to ever be born with 49ers. If you can tell from the picture with what has not been blacked out, the patient has facial dysmorphism as well as ocular hypertelorism. Hypertelorism is an abnormally increased lateral distance between the eyes. This child was the first child of a 26-year-old mother and 23-year-old father, and he was born at 38 weeks of gestation by C-section due to fetal distress and was admitted to the NICU because of respiratory distress. He was discharged after 7 days but revisited the doctor often and throughout the rest of his lifetime. This information was found through a case study of neonatal diagnosis of 49 XXXXY syndrome by Katayun Edamati. Moving forward with the history of this subject. Since this diagnosis was brand new at the time, there was very little information and many unknowns. People with disabilities have a history of being mistreated, neglected, abused, and institutionalized. According to Action for Access, laws were passed that led to the forced institutionalization and sometimes sterilization of many people with disabilities well into the 1970s. Sterilization was a procedure that was performed on people with disabilities to ensure that they would not be able to have children, eliminating the chance of any disability passing onward. The concept behind that process was based in the medical model, which I will reference again later in this presentation. But the medical model is a model of disability that believes that disability is wrong and that there needs to be a cure and is abnormal within society, when in reality, disability is one of the most common things that can occur, and it is the largest minority, and it can happen at any time. People can be born with disabilities. Disability can occur later in life due to an accident. Intellectual disabilities are a chance of occurring, and so much more. Throughout the 1960s, so right around the time when that first case of 49ers came about, people with disabilities joined the civil rights movement to fight for equal treatment. Although this was beneficial, nothing changed for quite a long time. The Rehabilitation Act was not passed until 1973. The Education for All Handicapped Children Act was passed in 1975 and had a name change in the 1990s, which now is known as IDEA. IDEA is Individuals with Disabilities Education Act. And finally, the Americans with Disabilities Act was not passed until 1990. People with disabilities were mistreated and suffered for far too long until anything was done in the government system. Today, we still see mistreatment and institutions still exist. Moving on to stereotypes and the impact these stereotypes have on the disabled community as well as society as a whole. Some stereotypes are as followed. People with disabilities are broken and need a cure. People with disabilities are dumb. And this is also a stereotype that treating adults with disabilities as if they are children. All of these stereotypes belittle people with disabilities and push society further and further away from creating equal access and respect for these individuals. This information was found in a study, Stereotypes About People with Disabilities by Lori Block. Additionally, when it is assumed that all disabilities are the same, people are not receiving the proper care that they need, leading to all types of concerns socially, medically, politically, and more. People with disabilities are capable. They are people too and deserve to be treated equally. Tearing down stereotypes and recognizing each syndrome independently is crucial in order to provide these people with the tools and assistance that they need to succeed. Continuing on with stereotypes and impact, this is when my heart and soul comes into this presentation. Stereotypes have left a lasting impact on people with disabilities, making it significantly more difficult to navigate society. As you can see on the picture on the left, this is a picture of my brother and I. My brother, Jacob, is 23 years old and has 49XXXXY syndrome. Stereotypes have caused individuals to act differently around my family and I when Jacob is or is not around. They can talk down to him even though he's a full-grown adult. And there's a lack of care and assistance from the government, education opportunities, and more. My family has jumped through hoops constantly to try to get the things that Jacob needs in order to be successful. But time and time again, we are asked to prove that he has a disability or not believed that he needs what we are asking for. The system is broken and more needs to be done to change that. Next is current issues. Despite the numerous years and improvements in technology, generalization of different disabilities is still occurring and negatively impacting society. Disability is the largest minority, yet it is the most underrepresented. Throughout my studies, I found that about 20% of the population have a disability, and that number is constantly rising. Lack of inclusion of people with disabilities in the workplace, school, media, and more. Again, this is based in the medical model. People feel that disability is wrong and needs to be fixed, and so that's why we always see able-bodied figures in the shows that we watch, in the workplace, everywhere. Additionally, there is a great lack of economic support. It's extremely challenging and difficult to receive assistance for disabled people with what they need. As I mentioned in the previous slide, my family has had to jump through numerous hoops in order to get Jacob what he needs. And oftentimes, when those needs are met, they are insufficient. As I mentioned earlier, the system is broken, and many people who acquire jobs to help people with disabilities are often found to be mistreating those individuals with disabilities, and they're often in it just for the money or the benefits that they may receive. Lastly, another issue I found prominent to discuss in this topic is the healthcare inequality. Gloria Cron shares in her healthcare study that approximately 75% of people without disabilities have private health insurance, but fewer than 50% of people with complex limitation, severe disabilities, are privately insured. While it is important to recognize those issues, it is significantly important to recognize what can be done in order to solve them. Here are some solutions that I have made up that I think would make a tremendous difference in society today. There needs to be more education about disabilities in school. From a young age, there should be talk about what disability is, what that looks like, and how it's acceptable, and we should all be accepting to all people. Especially, I think there needs to be more discussion about this in higher education for people who are going into medicine. That way, they can be equipped to treat anyone and everyone. Another solution I find important is that we need to stop tolerating stereotypes and comments that misrepresent the disabled community. There is still usage of the R word, which is no longer used as a medical term, and many other negative stereotypes that are breaking down the representation of people with disabilities. Next, as I kind of hinted at earlier, we all need to respect and love all people. This seems so simple, but it would be transformative if this actually occurred. If we stopped caring so much about everyone's outward appearance or saying that people are too slow or things of that nature, we would be so much more compassionate and caring for one another, creating a better environment for all. And lastly, we should start asking more questions. I think people get scared of people with disabilities because they don't know a lot and they don't want to say the wrong thing, so they just avoid it altogether. But that's not helping the situation either. That can be argued to be just as bad as saying negative things, because if you're refusing to interact with someone with a disability, then you're not being their advocate either. So people with disabilities would much rather prefer you asking questions and caring about their response rather than not noticing them at all. To wrap things up, 49XXXXY syndrome is a unique chromosome disorder that impacts men. Society needs to stop generalizing disabilities in order to advocate for equitable opportunities and inclusion for all. Stereotypes and assumptions negatively impact society by creating more barriers for people with disabilities. The U.S. has made progress in passing laws that cater to disabled people, but there is still so much more work that needs to be done. My experience shapes who I am today and allows me to educate others on disability, which I hope I've been able to do throughout this presentation. Disability is not something to categorize, stereotype, or avoid. Rather, it is a natural part of society that should be respected and advocated for. Here is an APA formation of all the references I used throughout this presentation. Hopefully you were able to learn something new today and can recognize the importance of not generalizing disabilities, breaking down stereotypes, and recognizing where we're come and where we need to go to next. I've enjoyed my time in the History of Disabilities class, and I look forward to applying everything I've learned in the near future. Thank you.